ship without a captain is adrift. Treatment can float along without focus, wasting precious months. What I'd like you to do is read through the skill statements under captaining the ship and the 3 C's, and then watch the 2 examples of these therapists as they staff a student and treatment team. So we're talking about John, and yeah, he's been really struggling, hasn't he? In session, I had one of the worst sessions with him. He flipped out at his dad and flipped out at his mom, and it's probably the 3rd week in a row that he's done that, and I don't know. I don't know what's going on with him, because I guess I would have thought that by now he would have had that under control. But the thing that's so crazy with him is there's so many things, right? There's ADHD, he's oppositional, he has a terrible relationship with his parents, he struggles with the boys on the floor. I know he's reading too much, right? He's always got his nose buried in a book, so he's kind of isolating from the team. He struggles with the female staff, right? He's more disrespectful with them. So does anybody have any ideas of like where we should go with John?
Really, just wish he'd follow his boundaries.
Yeah, he just needs to do what he needs to do, huh? He just needs to work the program, and I honestly believe if he would make a commitment to just work the program and take the things that we're telling him seriously, I think he'd be a whole different kid. But so I think we just need to stay the course. Just don't let him get away with things. Hold boundaries with him. Keep holding boundaries with him. And I'm just going to keep chipping away on him in therapy. And I see him making progress. I see him making progress little by little. And we just need to keep going in that direction. And so, all right, who's next?
So residentially, we're seeing this kid as insecure. Is that correct?
Yes.
Yeah.
Now, that shouldn't surprise us too much, because if you look at his history, if you speak to his parents, they would tell you that insecurity is one of the most pervasive issues in his life. And how it manifests itself is he succumbs to peer pressure, he's always interrupting conversations, he always wants his voice heard. Is that what you're seeing?
Yeah.
Okay. Okay, so what I want to do is I just want to quickly summarize the issues, give you what I would call the big ticket item. We're going to prioritize the issues. This insecurity, I think, is the big ticket item that we need to work through. There are other issues as well. There's ADHD. We know he's inattentive. We know he's impulsive. We know he's easily distracted. We know he needs to work on the basics, because he certainly wasn't cooperative at home, and he certainly wasn't respectful to his mum and dad. But if you peel back all the layers, the big ticket, the most pervasive, is that insecurity. So that's what we're going to focus on first. How does that sound to you guys?
Sounds good.
Sounds great.
So I've given it some thought of how we're going to address this. We are going to address the ADHD. I know Dr. Coates is putting him on some medication, and I'm going to be teaching him some behavioural strategies in my office as well. But what you're going to be doing residentially is the way we're going to address this insecurity is we've designed an intervention, and it's called the moral compass. You may have seen him wear it. You've seen that thing that he wears around his neck? Well, as you can see on that compass, there's a dark side and there's a bright side. The dark side represents all of his insecurities. The bright side represents principled living. So what I'm trying to teach him is that you gain an identity via the principles you live your life by. So here's what it looks like. When we see him being insecure, you'll know what it looks like. He'll be succumbing to peer pressure. He'll be loud and obnoxious and intrusive. We've already seen that. When we see those types of behaviours, we flip the compass to the dark side. Now here's the goal. When John is consistently having less than 7 flips a week, that will be his ticket to the next phase. Does that make sense? And then when he gets to the next phase, the goal will be something like, and we'll plan this more with more detail when we get there. When we get to the next phase, it'll be something like 3 to 4 flips a week. But 7, does that sound like a good starting point?
I think it's doable.
How would we predict he will do? I mean, does he exceed more than 7 now?
Yeah, if you looked at for every time that
Yeah.
it would be.
Yeah. So what we want to do is we want to make this measurable, but we also want to stretch him. We don't want to make this easy. I think 7 would stretch him. So, any other thoughts or questions about this? Does it feel like this is the right issue to address first?
Yeah.
Okay. Thanks, team.
You can clearly see the difference between these two therapists. One therapist had a plan, was focused, had measurable objectives, and tended to focus more on the future of what do we do now and what do we do next, rather than focusing on the past. A therapist who is captaining the ship and focusing on the 3 C's has the ability to articulate the treatment goals and objectives to the parents. If you were to get on the phone with any one of these parents on these caseloads, they would be able to tell you the dichotomies, the things the boy is working on, and how we know he is making progress. Remember, progress in therapy isn't solely based on feelings or instinct. Proof is in behavior and demonstrated skills. The focus of treatment with a student shouldn't flip and flop based on microscopic observations or the whims of individuals on the treatment team. The therapist's job is to be the captain and to help the team stay focused and allow an intervention time enough to work. Remember, captaining the ship is confidence and leadership versus chaos and being passive.